When we submitted our abstract, at the time we have 53 patients. Now we have 60 patients. So today I'm presented 60 patients with TLL, LBL treated with anti-CD7 CAR T therapy. So those patients, 35 of them belong to refractory relapse TALL patient, and 25 of them belong to the LBL patients. So the median age was 19 years old, from 2 to 47 years old. Median bone marrow blast was 4.4%, but can be as high as 88%. Some of patients had quite a very high peripheral blast in their blast count, up to 30%. So, and the median prior line of therapy was 5. And quite a few patients, more than 50% of patients, even have extramedullary disease involvement, including 9 patients had CNS leukemia, and 17 patients have a localized Bogey disease, and 11 patients had a diffuse extramedullary disease involvement. Also, up to 22% of patients who had a prior allo transplantation and failed the transplantation, then pursue the CAR T therapy. And 30% of those patients also belong to the high-risk group of ETP, and 8 patients have a complex cytogenetic abnormality, and 6 patients have like still Tau1 fusion gene, 6 had a TP53 mutation. So those are all heavily pretreated patients. So we give them single dose infusion of anti-CD7 CAR. This is made fresh from patients' peripheral blood, and also could make from their previous transplant donor. Each patient only need 1 infusion at the 1 of the 3 dose level. So about half of patients receive lower dose, half of patients receive intermediate dose, only 1 patient receive high dose. And our manufacture success rate is very high. Only 1 patient failed manufacture, 98% all success rate. So then we take a look at our day 28 complete evaluation. We take a look at the bone marrow. 51 out of 54 of those patients actually able to achieve MRD negative CR/CRi, and the other 6 patients without bone marrow involvement at enrollment, and also able to maintain progression-free in the MRD negative status. For the 31 patients with extramedullary disease involvement, and overall response about 81%, and 58% of them can achieve a complete remission, and 23 able to achieve partial remission. In terms of our long-term results, we have a median follow-up about 221 days, up to more than 600 days. So for the total 60 patients, the 18 months overall survival and the PFS both are very high, can be up to the 73% and 55% respectively. And for those patients actually had complete remission, then 36 out of 47 of them actually preceded the consolidation allo transplantation, and the other 11 patients just the CAR T treatment alone without transplantation. Then 2 group, we compare the OS and the progression-free survival also significantly high in the group who received the consolidation allotransplantation. The overall progression-free survival was 61 versus 30%, so significantly better. So for the 11 patients without consolidation allotransplantation, 6 of them relapse. However, 3 out of 6 of those patients are to start with have a very aggressive disease. They never able to make for the transplant. The other 5 still maintain in progression-free up to 180 days. They were still in disease-free status. So this product, generally speaking, is safety are manageable. A majority of patients only experience a grade 1 and 2 cytokine release syndrome. And only 10% of patients had a grade 3, we call it CRS. And only 2 patients had a grade 1 neurotoxicity, and 1 patient had a grade 4 neurotoxicity. Regarding the infection rate, we monitored from the CAR-T infusion to the transplant, all to the last follow-up. And 2 patients had the CMV reactivation, and 3 patients had an EBV infection, and 2 patients had a fungal infection. However, none of the patients died from those infections. So in summary, so this is a good product, and also when we look at the peak in vivo expansion time by either by qPCR or by flow cytometry, we're around day 15, and also able to persistent well per PCR analysis. So the method to generate those anti-CD7 CAR-T is quite novel. Those CAR-T cells were actually manufactured by producing the bulk T cell, transducing bulk T cell with anti-CD7 CAR, then subjecting them in a natural selection into the cell culture. So after cell culture, you can see the majority of those cells turn from CD7 positive CAR negative to CD7 positive CAR negative by flow cytometry analysis. So when you take a look at further analysis, you can still see those CD7 protein and mRNA are still present in those cells. So that's indicated that this fracture site resistance were achieved by CAR-mediated CD7 epitope masking or by intracellular sequestration. So generally speaking, in final summary, this is a very high effective and safe products, and treated even with pre-heavily treated patients, for those patients with extramedullary disease involvement, and for those patients who relapse from previous transplant. And I think this is entirely new anti-CD7 CAR-T therapy really provided a hope for those refractory relapse TLL, LBL patient, a hope and also a hope to be cured.